Hi everyone. So let's start. Let's not wait. I hope our speakers for today are here. I can see the names. Charanjit ji is here. Sarab ji is here. Can you guys just say hi? Hello everyone.
Hi Ajit,
Hi Charanjit. How are you? कैसे हैं आप?
I'm good. How are you?
Yes, all good. सरब जी हैं? Okay.
हेलो डॉक्टर जीत हाय चरणजीत जी या आई एम देयर पहले आपने हमें म्यूट कर रखा था तो आई वाज नॉट एबल टू से एनीथिंग
अच्छा, okay. No worries. I'm so sorry.
नो वरीज
Okay, so Samriddhi and all are here, my team, guys. So be alert. Okay, guys. So I welcome you all. Thank you very much for joining. I can see a huge crowd here and almost many people in YouTube as well. There are many people who are joining us from the YouTube. So, guys, thank you very much for joining, and I welcome you all to this free webinar on the career opportunities and scope into specific domain what we are going to discuss today. And let me tell you, this is not done. We are continuing from today, and it will go on because we have to cover many domains. Today we are talking about medical coding and medical writing. Next week we'll be talking about project management and CDM, clinical data management. Okay, so this type of webinars will be going on for 2-3 weeks. So you guys be alert and be with us to know all about career opportunities and what else can be done, what are the things to do after these jobs, and how you can get enter to such industries. So guys, again, I welcome all to this wonderful webinar. And let me tell you, so all of you, I mean, I don't want your time just to attend the webinar, so you all will be getting the certificate also. Okay, you all will be getting the certificate also, but certificate is on only on one condition. If you are attending the webinar till last, if you are attending the webinar till last and filling the attendance come feedback form, whoever is staying till the end will get the certificate, and whoever is not filling the form at the end attendance form, they will not get. Anyways, we are tracking the attendance. So uh, proudly I can say that today's webinar there were 1500 plus registrations only in last 24 hours. We have launched only yesterday morning. Okay, we kept it in our social medias everywhere into our community just yesterday morning, and since yesterday morning till now there are 1500 registrations, and I can see the crowd, almost 20% crowd is here. Almost 20% crowd, more than 20%, because we have around 50 in our YouTube channel right now. So yes, there are a lot of people, lot of you are joining us for this specific um, webinar. Guys, please refrain yourself from sending the personal messages to. Okay, 1 second, no worries, you guys join here, then I'll see. So okay, so let me tell you one more important thing other than filling the form. Let me tell you one more thing, that you guys have to have one more fantastic opportunity today. We have come up with the some more opportunities for you. We brought, what is that you want to hear? That is nothing but you all will get one more chance. Okay, you all will get one more chance to register to these two certificate courses. Okay, to the medical coding and to the this medical writing course, because the registrations are over. Okay, registrations are over, but still you will have the chance. Okay, you will have the chance to register again for these courses today itself, only today. Okay, so whoever has missed the opportunity to register into these courses, this is a great opportunity. And a lot of you were asking me about the demo class, about the career opportunities, about the salary aspects. A lot of questions I was getting, and a lot of questions are there in the form what you have filled. And now I must say you all that the specialists, the experts of the domains are here in front of you. Okay, in this webinar, live with you, Charanjit ji and Sarab ji, please ask your all the questions. I mean, they are presenting a few slides. They will be telling about all the questions, whatever you sent through the the Google form, but whatever remaining questions you want to ask, you can ask them live in the chat box here. They will be answering all the questions, and then you decide which course you want to choose. And if you are interested, register by today, because we have only a few seats remaining in medical writing and only a very few seats remaining in medical coding batch. Medical coding batch, we already have around 85 students with us, only 15 uh students we are, right now we have the seats, 15 seats we have. Okay, and medical writing we have only 5-6 seats. Okay, so if you are interested, you can join these courses, right? So just let me show you once these brochures, and then we can start with the webinar. Okay guys, so here you can see our 4 months executive certificate in medical coding. So this is a 4 months course, and you will be, getting about all the things. You will get all the material. You will get 100% placement assistant from our side. We will be conducting mock tests. We will be referring you to the industry, and we'll be conducting multiple tests, mock interviews, lot of things. Okay, you will get 100% placement assistance from our side in both the courses. Okay, and you can see the syllabus also. You could see in the brochures we have shared before, right? And this course has already started. Today is the first class, definitely. So you all must be knowing about career opportunities. So that's why we have conducted this webinar. And then the price of this course is just 2,999. Okay, just 3,000. Just 3,000. And you in the market, if you go, it's very costly. I'll not say which institute charges what, but I'll tell you this is just 10% or 15% of the other institutions. Okay, and similarly, medical writing course, this is a diploma course what we are providing, and this is our 8th batch. This is our 8th batch and second under Curio. So this is a fantastic course what we are providing for last almost 4 years, 3.5 years. So in this, you will get 2 books which are the full course material written by our experts. 2 books worth around 1,000 rupees in that, and you can see the comprehensive syllabus, and the course is starting in the first week of September, and you will have all the our testimonials of our alumni of these courses, and the cost is just 3,999, 4,000 for this diploma course. Okay, so whoever is interested, guys, you can just register for these courses by tonight. You will have this chance. Otherwise, you will not have these chances later. Most probably, we are not, extending many dates. So if you're interested, you can do it after the course. We will share the links and all. Okay. So now let me take this privilege to introduce our 2 speakers today, who are going to speak on the, one second, on these topics. So first speaker, I mean, the first topic we are taking is the career opportunities and scope in medical coding, right? So we have with us Ms. Charanjit Kaur. She has the 8 years of experience in the medical coding in the US healthcare industry, and she has demonstrated proficiency and commitment to the excellence. She has started her journey in 2017 in AR and billing, and later she did a wonderful transition to the medical coding, and then pathology diagnosis coding, and then emergency and surgery coding, and many more. Okay, and she later interested with the leadership responsibilities, stepped into the role of team leader, and now she's working as a manager and overseeing both coding and non-coding teams. Okay, and she is now passionate. She's passionate about nurturing the talent with medical coding community since 2018. She is a medical coding expert and teacher as well, mentor. Right. So today I'll ask all of you again to ask a lot of questions. Whatever queries about the medical coding do you have, you please ask all to our expert. And the second expert about medical writing we have with us, you all know very well, Miss Sarabji is from GSK. She's clinical trial transparency manager at GlaxoSmithKline, working okay, and then she's from the biotechnology background, and she has written 2 books in pharmacovigilance and medical writing. wonderful career opportunities. And she will be talking about the medical writing today and scope in the medical writing. So she is our mentor as well for the medical writing. So ask as many as questions you could ask, right? She is a published author, and she's expert of medical writing and transparency, right? So ask as many as questions you can ask. So I will not take much time now, guys. Over to our first speaker and first expert, Charanjit ji. So that's all from my side, guys. Thank you all for joining. I could see that there are 350 participants in this webinar. Thank you, guys. So over to you, Charanjit.
Thanks, Ajit. Thanks. Thank you so much for such a good introduction. So before going into the depth, let me share my screen. I have created a PPT so that everyone can know what is the medical coding and what are the opportunities. So I'm not going to give my introduction because you already covered that. Thanks for that. So I'm directly going to the point that what is medical coding? Does the team know what the medical coding know? Does everyone know about the medical coding, or we have to speak?
Just make
Anyone?
the full screen, Charanjit. That would be great. Thank you.
It's not the full screen. You want me to?
Uh, yes, now it's full screen. Yes, yes, yes. It's perfect.
Thank you. Okay. Team, did you know what the medical coding is, or any question, anything which you know about the medical coding? Okay. So I got the answer. No. So medical coding is a process. Okay, let me tell you. So medical coding is a process where we have to transform all the healthcare diagnosis as well as the procedures supplies into the universal medical alphanumeric code. Medical coding is such a good professional, such easy and good professional course, because in the medical coding, everything is predefined. Why I'm saying predefined? In the medical coding, we will get three manuals for the diagnosis, one for the diagnosis, one for the procedures, and one for the supplies. We have to look at I have mentioned here. So this is for the disease, this is for the procedures, and this manual for the supply. In these three manuals, we have everything predefined and approved by the WHO. So everything is approved by the WHO. As a coder, we just have to locate the code, apply the guidelines, the coding guidelines which we have got from the multiple payers. Payers means insurance, and send the claim to the insurance. So medical coding is just converting the procedures and the medical record into the universal medical codes. But the need of medical coding is because this is a part of the RCM service. RCM service means revenue cycle management. This is a cycle made for the US doctors, which helps the doctor to get the reimbursement for the services they have provided. So in India, what we will do, we will just go to the doctor, provide the charges, give the charges, and get the service and come back to the home. But in US, everything is paid by the insurance, which is also known as payers. So everything is paid by the insurance, and for everything, we need to submit a claim. We need to submit a claim to the insurance, then only doctor will get the payment for the services they have provided. So coding is a part of the RCM services. We have different part also. We have billing, we have credentialing, we have account receivable and medical transcription. Everything have a different roles. We will just stick to the coding because right now we are talking about the coding. So we will just stick to the coding. We will not going into the depth that what is the role of the billing and what is the role of the transcription team and another team. So if we discuss medical coding as a brief, then so we have to just transform the diagnosis. If we got the hypertension, we have to use a code item. We have to transform the medical diagnosis into the alphanumeric universal code and submit those codes into the claim to the insurance. Anyone have any doubt in the medical coding now? Medical coding is clear. This is a brief of our medical coding. Okay, good. I got the answer. So next is why medical coding is required. I already told you what the medical coding is. Now question is why? Why we should go for a medical coding? It's a very basic. It's everything is predefined. Then why we need the coder separately? So medical coding is a part of our RTM cycle, and every doctor write the conditions in a very varied way. Like some doctor might mention hypertension as an HTN, some doctor hypertension. So there is a different way of the documenting by the providers. As a coder, we have to find out the universal code and send the codes to the to the insurance, so that we have a data for the mortality as well as for the morbidity, so that we can use that data for the research purpose. And we have to keep the records for we don't need to keep the records for a long time. So medical coding is a completely electronic process. This is an electronic process. We just need to find out the codes electronically. We have to submit the code electronically. So keeping the record electronically is much easier than keeping the records into the paper format. So this is a major factor that medical recording is required, because we have to submit our claims in a proper form into the proper codes for a proper reimbursement. Reimbursement means what? How we can say reimbursement? Reimbursement means getting money. In a easy language, we can say the reimbursement for the services the doctor have provided. So provider, the services provided by the provider. Provider means doctor. We need to help the doctors. We need to help the providers to get the reimbursement for the services they have provided. Hypertension is such a easy thing. In the medical coding, later on we will read into the depth that what all the procedures can cover into the medical coding. It includes the major surgery like CABG and the minor procedures like chemotherapy or even the laceration repair also. And we have a particular guidelines to build the major surgery as well as to build the lowest surgery like laceration repair or just scrapping it or just for a debridement also. So in later on we will read about the guidelines that what all are the guidelines for billing the codes. Next one is importance of medical coder. That why we should hire a medical coder. Everything is electronically, everything is now AI based, then why we need the medical code? So the role of medical coder is accurate billing. Accurate billing means sometimes AI can't catch the complete judgment behind the provider transcription, provider report. So as a coder, we have to read the report. We have to apply the guidelines given by the WHO and the CMA, as well as AAPC and the AMA. These are few institutions which will give the guideline that what code needs to bill at which condition. So AI can't use the judgment and can't use the complete guidelines to bill the accurately. Sometimes we have to use a judgment, like if the patient is 70-year-old, then we have to bill something else for the same condition. And if the patient is 7-year-old, then we have to bill something else for the same condition. So condition or the code also vary per age, per sex, date of service, as well as state. So code vary based on these things. So for accurate billing, we should know all the guidelines, and we should hire the medical coder. Billing can affect the provider reimbursement. If we will going to bill more, then provider get the more, as well as in the audit he will get the fine. So we have to pay the fine also if we will do the overcoding. If we will do the undercoding, it will affect the provider. So medical coder will ensure that they are going to bill accurately for the services they have provided. They are not allowed to overbill, as well as they are not allowed to do the underbilling. Medical codes are also used for the data analysis, which we just already discussed, that we have to use the code so that we can research based on the morbidity and the reason of morbidity and the reason of mortality, how many cases we have encountered for a particular disease throughout the year. For a data analysis, codes are much easier because that was read by the electronic system. We can't read complete documentation given by the provider to find out one particular diagnosis in a number of patients. But with the help of code, we can just analyze the data very well. So the second importance is data analysis. For the data analysis, we have to hire the medical coder. Now, better patient care. So I already told you, provider will not get the reimbursement until he submit a claim. So doctor is already involved in the patient care, or the nursing staff is already involved in the patient care. As a coder, we have to let them focus on the patient care. We have to take care of the services they have provided or for the reimbursement. So while we are billing their claim, they are good to keep their time into the patient care. Clinical documentation improvement. As a medical coder, sometimes we need to help the provider for the more documentation, for the more specification of our services. Like in our documentation, we guys are able to see that patient have a fever, patient have a cough, and patient have a respiratory disorders. His lab is COVID positive, but in the documentation, doctor does not mention COVID positive ever, anywhere. So we have to ask the doctor, hey, please mention COVID positive to the patient documentation so that we can build the COVID positive status for a patient. So we help the doctor so that he can improve the clinical documentation. He can improve or he can mention all the specification for our services they have provided. So we will help the doctor also to get the documentation improvement. And at the last and the major one, we will facilitate for the reimbursement for the services they have provided. This is the main reason we got hired. So for the reimbursements, we will help the doctor for the reimbursement, accurately reimbursement for the services they have provided. As an coder, it's our responsibility that we are going to build everything which is given to the patient and every services which is given by the provider. Any doubt in this slide? Any doubt so far? Okay. So I can see we have one question. What is RCM cycle? RCM cycle is a revenue cycle management which includes multiple steps through scheduling the visit until we get the complete reimbursement for the services. So there are so many teams involved in the RCM cycle, which helps the doctor to credentials from billing, coding, medical transcription, and account receivable. The work of the account receivable to get the money for the denied claim. They will work to get the money for the denied claim, and if insurance said, hey, we are not going to pay this due to this and this reason. So then account receivable involved and get the money for the services they have provided. So this is a complete cycle. We will not going into the depth of the RCM cycle. We will discuss later when our classes will start. We will discuss each step of the RCM cycle later on. Moving further. Next, we have scope of the medical coding, that why we should do the medical coding. We already know the importance. We already know our role, but why we should go for a medical coding. India is our second largest healthcare outsourcing destination. Right now, we are getting approx 80% of medical coding business or RCM business from the US to India. There are multiple factors of getting work from US to India. The first is cheap labor. We are not going to charge same as a person sitting in the USA. We are more educated. We are more skilled. They got more skill set in India instead of the USA. And this is the main reason that we got nearly 80% of work in the medical coding. for the medical coding, and there are other aspects of the RCM cycle also. We have huge big companies like UHG, which is TCS, Accenture, who is getting the projects for the medical coding. So this is a major reason. We are the second largest healthcare outsourcing state. Second is our supply is less. That we are not able to fulfill the demand. Our supply is less, and that's the reason we are not able to fulfill the demand. The major reason of the less supply is that people is not aware what is medical coding, why we should do it. People is still stick to the, normal professional courses like other professional or bachelor courses. So that's the reason we have 40% less supply compared to demand. And this is one of the major reason that in medical coding, people will save, will get the stable job. They will get the good or handsome salary. They will get the opportunity of the work from home. So there are other few aspects of the medical coding. We have the good demand. We will get the job stability. We will get the flexibility. Flexibility means we can work from the home. We can work based on our time. We can change our shift timing. Like if we want to work on 11 to 8, we will tell our TL or our manager that, hey, we will work from this to this time. And our manager should, they have to approve our request because we have limited coders. So we get the flexibility, we get the career advancement. Now, what the career advancement is. So, as Ajit just told, that I am working into this profession from last 8 years, and since last 8 years, I got the post of the manager, and now I'm handling 100+ users in my company. So, in 8 years, you will get the role of the junior coder, you will get the role for a senior, you will get the role for a SME, TL, assistant manager, DM, and the manager also. So we will get a good chance for a career advancement. We will get a good chance for a promotions. If you are allow yourself to work more, you will definitely get the advancement in a less time compared to other domains. Because in other domains, we are filling the supplies, we are filling the demand. But in medical coding, we are not able to fill the demand of the industry. We also get the competitive salary. I have also include the screenshot from the Naukri.com that I will get you the salary illustrations. So we will get the competitive salary. These are the 5 major reasons for being a coder. I feel these are 5 are the major reasons that one should go for the medical coding. So these are the best companies in the industry. I already told you this is best, not all. We have a huge market for the medical coding. We already told you that Accenture is getting one process. We have a process in the TCS. We have a process in the EXL. So these are the best only. We have so many other companies, and all these companies have a very huge amounts of coders. I think Coro Health is going into the 20K. Omega, we have 30K coders. UHG having the all different process of the medical coding. So these are few best companies which you can refer after the course in medical coding. So this is a screenshot of the Naukri.com which I took. So you can see here, you can get the opportunity of the work from home. This is a screenshot I've got for the freshers only. I make sure that I will select the fresher. So in the fresher, you will get the salary of 2 to 4 lakhs per annum or 2 to 5 lakhs per annum. You will get the day facility, you will get the cab, pick and drop. Oops. Sorry. Okay. You will get the pick and drop facilities, but all they need CPC certified. The person need to be CPC certified for the job of medical coders. We need a CPC certified. CPC certified means there is an exam held by the AAPC, American Academy of Professional Coder. This exam is based on the US structure. So we have to give that exam. We have to clear that exam to get the CPC certification. CPC stands for Certified Professional Course, or sorry, Coder, Certified Professional Coder. So once we get a CPC certification, everyone can know that, hey, we are the medical coder now. Any questions so far? If we choose medical coding as our career, are we at the risk? Okay. So I already told you, AI will definitely help us to get the closest code, but AI can't replace the coders, because AI is not able to implement all the guidelines. AI is not able to judge the condition. AI is not able to, you know, what I can say, like I already told you, if the same condition, a person having a 70-year, we have to vary the code, and if the same condition person having the with the age of 7 years, we have to change the code. So we do have AI in the place. There are some systems like 3M software. We have a Epic, which is getting closer to the codes, but they are not able to find the code. So we have to hire the coders to review the complete medical record and code based on the documentation. So AI is still there. We have the AI in medical coding. It's not like we will not going to have the AI. We do have the AI right now. We have 3M software, we have Epic software, which is still start working on the AI. Any other question? How to get the CPC certification and the exam process regarding the same. Okay, so we are going to train you for the CPC certification. We will give you the complete training for a CPC certification. After the training, you will be you are going to give the exam, and you are going to crack the exam. In my experience from last 7 years, I think every student got clear in first attempt. There are 2 attempts in piece of 1. So every student going to clear at the first step attempt only. Okay. So ma'am, I'm on 6th farm D. Can I work as a medical coder part-time? Okay. To work as a medical coder, you should be CPC certified first. Or you can apply for a non-certified medical coder. There are only few companies who hire non-certified medical coder. I will talk with the Ajit, and I will ask if our HR team will able to get into touch with the non-certified medical coders. If we are able to get in contact with the companies who are hiring in non-certified, then we will definitely refer you. But otherwise, a complete industry require the CPC certified coders only. Anything else?
Yes, guys. So, yes, I got their questions, Charanjit. So they are asking, somebody is written here that CPC is not mentioned in the process. See, guys, this is the training along with CPC training as well, CPC exam preparations as well. Okay, we are giving
Yes.
a lot of things. Some things are not even mentioned in the brochure. So this entire training, what we are giving is the medical coding training as well as the preparations for the CPC exam. Okay, and you also know very well, everyone, that CPC training, I mean CPC certificate course cost, I mean CPC certification cost is around 40,000. That cannot be covered in 3,000. So that we are preparing you for that. If you are willing to, write the exam and get the certification, you can do it. As Charanjit ji just told, that there are some companies which takes the non-certified coders, or there are some companies, good companies also, they take the trainees and then only they allow them to write the exam, right? And under their some industries I have seen that they only pay the fees for the examinations once you are trained, and they then continue your job in their company. So don't worry about anything. We are here to prepare you for the CPC certification as well. Okay. And we are not charging anything extra for that from you. That is completely covered in that. We have mock tests. We have, all the tests, 4 5 tests also, for the CPC certification. That all is included in our, entire syllabus, what we are providing in this medical coding training and medical coding course. Okay. So I hope you are, now your questions are answered. Yes, CPC is costly. CPC certification is costly for around 40,000 rupees, if I'm not wrong. Charanjit ji, how much is the fees for CPC certification?
It's 65K. We
65,000.
have, we
65,000.
have to pay
Yes.
in dollars because
Yeah.
this is a USA base, so we have to pay into dollars.
Yes, 65,000. Yes, 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 yes. So,
So
yes, if you, yeah,
we will get, yes, definitely you will get the training for the CPC only.
you will get the training and preparations for CPC also from us, with
Yes.
us from this course. Yes, definitely, Tarannum.
So our syllabus include everything which is equivalent to the certified professional coder exam.
Exactly.
We will provide you the mock also for in the same format which we will get in the exam. So we will provide you the mock which we will get from the APC only. So
Yes,
everything is based on the CPC. For a medical coding,
yes,
this is a basic requirement.
yes,
This is a basic requirement. You should be CPC certified, or even you are not CPC certified, you should know anything which is covered into the CPC module.
yes.
Anything else?
Okay, so somebody is asking is 65 for the lifetime validity if they clear the exam?
In the 65,000, so we got the 1 year membership, as well as we will get the 2 attempt for the exam. Two
Okay.
attempt for exam. If we
So
get clear on the first,
I think they're asking if they get the certification, it will be valid for lifetime, right, Charanjit ji?
yes. If they got
Yes.
clear, that certification is valid for the lifetime.
Perfect,
You don't
perfect.
need to
Okay,
repeat
Prabdeep is
exam again and
asking.
again.
Prabdeep has written 65K exam for 23K, 20 to 30,000 per month job. Is it worth it? Dear,
Yes,
you
it
are
is
paying,
definitely.
see, you are paying
Sorry.
5 to 6 lakh, 10 lakhs fees for the course. Does it worth when you start with the 15,000? I'm very blunt in certain things, 65,000 rupees for the exam. And if you're getting a lifetime job and lifetime career opportunity, I don't think it's a problem, because we all have to pay for the education and our progress for the career, and that is the fees is defined by the US committees,
Yes.
APC. Yes,
And we have so many coders that also going for the another specialities. Like I have mentioned here, another specialty, and all specialty cost the same.
yes,
Every person who got cleared into the multiple specialty, they will get the salary hiked. In the
yes,
medical coding, you will have a safe job or stable job. You don't need to go here and there for a job. You don't need to shift your state to get a job. So you will get a stable job, and this is the cheapest professional course I can know for the for a better job, for a job for getting 25K in the starting, and the
yes,
maximum salary of a coder at the position of coder only. So maximum salary of the coder is 95K per month in just 5 years.
yes,
Once you get a post of SME, I have already mentioned here, let me show you. Just a second. So this is a career growth. First, you have to work as an intern, then junior medical coder, then senior medical coder. At
yes,
this position, there is a company who is hiring at 95K per month for a coder level with just 5 years of experience. The
yeah,
Coro Health is giving 65K for a person who is having 2.5 years of experience in the A&M and the surgery. You can go into the naukri.com and you can find the salary slab per year experience to know further. So you will get this much of salary on the basis of the certification exam, because clearing the certification is not easy if you are not trained well. You have to give your time, you have to give your sweat to get the clearance in the CPC certification. So once you reach there, you will work as a quality analyst, you will work as a group coordinator, team leader, a manager, and so on. The salary will definitely increase. So if you think 65K is too costly, it's not just about 65K. You have to give your time also, you have to give your sweat also.
Absolutely.
Sorry,
Somebody is asking which coding language does the CPC training include? Say there is no coding. Okay, this is not a coding. This is like there is already the book of codes. That is the book. You know, if you have read in your courses, hospitals, if you have seen in the hospitals, right? The codes, the healthcare disease codes, the disease codes in that sub codes are there. Okay, if you have read that book is there. Okay, so that is updating every year, every 2 years, and we will teach you, we will train, our trainers will train you in that, how to do that coding, and how to, there are the cases. The main thing is on the live cases, right? As she was just telling that the doctors write just the signs or symptoms, the age, the summary, but they don't write the code. So you have to find out the code, and then you have to mention in the insurance company, or you have to mention in the portal, the claim portal, and then they will get the claim, right? So that is important. Understand? There is no language, there is no Python or anything. There is no coding. You don't have to code in the computer. Okay. You all will get the recordings. I have shared the link also here for the registration. I have shared the browser also. Can you show the Pradhan Mantri Yojana slide? What was that?
okay.
Okay.
This slide I've just added because in the India we get the Ayushman Bharat uh, up there, or let's say this is a insurance. Like we have a Max Life insurance, we have a Apollo, we have a Star. So in the same type, we have a Ayushman Bharat, which will help for which will cover the persons who is below the poverty line, and Ayushman Bharati is likely to ensure appoint at least one person for all in panel. In panel means for all inpatient or in network hospitals
Yes.
to have the certified medical coder so
Yes.
that they submit the correct claim. So now in India, we have a TPA department which will going to
Yes.
code ICDs, which will going to code the CPTs. So this is a slide.
Yes. So, okay, the question is, yes, Kaushik is asking, will the training provided by AAPC certified coder? So, Charanjit ji is having the certificate. I was introducing what time. I think you were not there. Yes, that time. She is trained medical coder. She is now working as a manager, having multiple, not only one CPC, but multiple certifications in coding, and working as a manager, having 8 years of experience. She is our trainer for medical coding. Okay. Yes. Eligibility, there is no eligibility, specific eligibilities for CPK certification. Pooja, you will get the right guidance here. We have all the experts with us, and I have shared the link also. If you guys wish to join our course, you guys can directly join our course here. Okay, today we have extended some more. I mean, for the today, you will have the chance to register again, guys. Okay. Any other questions? We'll take one or two more questions, then we'll go to the next webinar, guys. Okay. Okay, let me see one or two important questions. Yes, Bhardwaj, Kaku Manu. Yes, you are the fourth year family. You can pursue that course. Definitely, it will help you in future for sure. Okay, job security in upcoming years. That's there. As she was telling, job security definitely. As she is telling, that supply is less. We have 40% less supply than the demand. Should we need the complete family before attending CPC exam? I'm not sure. What do you say, Charanjit ji? They have to have the graduation with them, or they can join directly. They can give the
They
exam
does
directly.
not. Yes, they can give the exam, CPC exam directly. Graduation is not necessary.
Graduation is not mandatory, guys. Okay.
But there are few companies who will look for the graduation, but there
Yes.
are few that will not require.
Yes. 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 Should we need to complete family? No, no, no. It's not necessary. How much salary in the manager post? Dr. Farai is asking. I'm asking how much salary is in the manager post. I think she was telling around a lakh, if I'm not wrong, more than that. In 5 years. In 5 years, the salary is around 1 lakh per month. Okay. AIC has talked about. Array, Bhardwaj, we have talked about no need to complete the Farm D. Why you are typing and just copying, pasting one link, one comment only? Medical coder is hired by the hospital management or by the insurance companies. See, right now, US market is open for all. US market includes all the hospitals also and the insurance agencies also, both. Okay, we need to learn all the codes. Yes, definitely. Will the market get saturated due to criteria which says a person becomes a coder without being a
Ajit,
pharmacist?
just a second. We don't need to learn a code. There is no requirement to learn even a single code. We have the manuals. We just need to
Find
learn how to. Yes, thank
how
you,
to
Ajit.
how to find out. Yes, sorry.
So,
I think that's all. All the questions we have. No, 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 no Sanskriti. We don't have to by heart all the codes. As she just told, we have the manuals for that. Okay. Being from a certain medical must help in finding job as a medical coder. Do companies prefer orders from medical background as doctors, nurses? Anyone can do that. It's not about the medical doctors and all, but that is not for them. This job is not for them because the starting salary and multiple other factors influence them not to join this course. Okay, I think we have covered everything. So guys, with that, whoever wants to join our course, you can definitely join. Okay. CPC exam is online, right, Charanjit ji?
yes,
Yes.
it's not online. We got some set of institution where we have to go and give the online exam.
Yeah, but
So there,
in India, they can pursue, right?
yes,
Yes, you can do that exam in India. Yes.
I think
We
I
will
have covered
provide you,
everything. I'm
Megha,
just
we will give you the book of medical coding also. We are providing the entire material to all of you. Okay. We are providing the material also to all of you. Abroad opportunities means, see, these are online jobs right now in India. You can work from the offices in India. I want to share my experience that I working with Kanak Mali, RCMR denials credentials. This SI future about slow and steady growth. Yes, definitely. Does this CPC certification is valid in abroad? Everywhere? This is from the US only. This is valid everywhere in the world, I believe. Yes, it is valid everywhere. Please suggest any book for exams and ICD coding. I think the latest ICD, manual we will teach from that, and we will give you that book also. Okay, when you are joining the course, we will give that also. Soft copy format. Okay, guys. So thank you very much for joining. I would like to thank Charanjit ji for joining us and enlightening our audience on the medical coding, career opportunities, and everything. I hope you got the insights and the questions, whatever you asked, you got the answered. Guys, so now we'll go to the next speaker. She's waiting, ma'am. Sarabjit ji, over to you. She will be telling about medical writing. This is another independent career option for the health science graduates. So over to you, Sarabji.
Yeah. Thank you, Dr. Ji. Thank
Thank
you, Charanjit Ji. I also learned few things. I was silently listening because I never ever worked in this domain. It's good to know, you can share with other student if they are asking. Dr. Ji, I'm trying to share my screen. Just let
Now,
me.
now you can share. Yes. Yeah, yeah.
So, I will keep my discussion concise and we will keep more time for questions. So, I'm presenting. Just let me know if you are able to see my screen.
We are able to see, but I think it's zoomed out. zoomed, isn't it?
Can someone confirm? I am.
No, I can see your screen. Screen is visible, but I think it's zoom.
It should not be.
Uh, okay, wait, I think.
Is it readable? Students, can you confirm? Is it readable?
Students, can you? It's okay, it's okay, it's perfect. Okay, fine. Then go ahead, please.
Okay. Because, all right. So, what we wanted to learn about medical writing. See, first of all, when we see this word medical writing, it sounds very fancy. This word is very fancy. Like, oh, this medical itself makes things very complex, and then a writer. So, but medical writing is a bit a technical profession. Technical when I say that because you are communicating a scientific and medical information with different audience, either the regulatory body like your DCGI, FDA, ethics committee, stakeholders. So what you have to do is that it is lot different than the content writing, than your literature writing, because here you are talking about the evidences. Someone has done a research, you have to present that research. And the important is here, you don't need, very advanced English, because you are always having source. You have to pick. Source means you have already have information in one or other way. Now you have to connect the dot, different dots, and you have to present in a given format. And this is a beautiful thing about a medical writing, that you write in a very simple English. You need not to have a high end vocabulary, high end grammar. The only thing is you need a dedication. And you should be hardworking. So we are writing for, just look at the thing, like these documents, they are very confidential, because we are writing for a regulatory body, basically government body. They are going to review your document. Based on those documents, they are going to give a license to a drug that you can sell on a pharmacy store only once you got a approval from your regulatory body. Ethics committee, they again approve. So the writing should be very accurate, and this is with your internal stakeholder. And another important pillar is that you also present this scientific information in very plain simple language. Like brochures for doctors, they are still some scientific terms, they are okay, acceptable. But when especially comes to your patient and common public, and this thing, the last two things, they are picking at very high speed, so that they are saying that whatever medical scientific document you are writing, also write the summary of those documents in a very simple language that a common person can understand. I give you one example: placebo. You as a pharmacy student can understand very quickly, okay, what placebo is. A common person, your neighbor, your dad, mom, they want, what is this placebo, right? So we have to write what placebo is. So that is why I'm telling you about these last two things, is because now there is another department where I am working. Clinical trial transparency is also growing in the medical writing. So medical writing field is expanding. So depending upon what is your likes, dislikes, you have a multiple options to explore. So in a medical writing, you speak about the evidence. So there is a data, you present it, right? Now let's speak about scope, because that's why we are here, right? Is it worth? Hmm? Do you need to go into a medical writing? Yeah, definitely, because India is becoming a hub of pharma manufacturing and research. And if you are reading a newspaper, you will see that many GCC, this is first is not that correct. Many GCC is a global capability centers of different pharma company. They are coming in India, like in a, think in a Bangalore, many companies like my company, own company, GSK, Merck, they have set up their GCC, global capability centers there. Now BMS, they have set up their global capability center in Hyderabad, Novartis already have since so many years. All these because they are setting in-house functions in these global capability centers, right? So which means there are like last year, many companies, I know the big pharma, they run the drive to hire medical writer. Walk in, just imagine, walk in for a medical writers. So there is a lot of demand, especially when we have these rules in India. They are a bit clarified. They're new drug, sorry, I need not to write this. New drug rules, 2019, once they are there, because then regulatory environment is little more clear. So after that, there is a lot of demand. And another is due to skilled profession and cost-effective services. India definitely till now, as of now, we are offering cost-effective services. So that's the reason they are setting up the global capability center. They're dissolving the teams in America and Europe. They are setting a centers here. So hence the demand. And most important, which is my favorite, career growth. Can't you imagine? I started my first job 10,000. So 10,000 was the salary of my first job. And within 6 months, that 10,000 turned to 33,000 because I learned. I learned and I applied for other jobs. Me and my friend were continuously discussing, okay, what next interview we have to give. But for that, you have to learn, initially, whatever opportunity you get, just step in, right? So career growth is a big thing in this medical writing. People say it is a career for life. You start as a medical writer, you become a manager. Now, I just started, even I have not started as a medical writer. I was in a operations. Then I switched to medical writing. Now I'm working as a senior manager in one pharma company, right? Then you even can aim be a director. I know one of my, boss, she has one now become BP, So you have a long, go in a career of a medical writing. And not only that, uh, Dr. Ajit knows, Dr. Ajit, Akshima, right? She also worked as a freelancer for some time
Yes, and
because
she's from the dental background.
dental background, because there was a time that she was not able to go, because of family commitment, she was not able to continue her job, right? And but she still likes to work, and she has worked as a freelancer for I think almost 2 years. So freelancing opportunities are also there in a medical writing. But again and again, I am saying this profession demands a dedication, good learning. So till today, the biggest challenge with pharma companies is that to hire a good medical writer. They are a position they are unable to fill for 4, 5, or 6 months. Can you imagine? Because they are not getting the right candidates. Now, these are just I'm giving you the entry level roles so that you can go to Glassdoor, you can go to Naukri.com, you go to LinkedIn, try to search these roles. These are all entry level roles like associate medical writer, regulatory medical writer, scientific writer, QC reviewer, very much entry level role. These are almost the work is a writer only, but this is different roles. So this is QC reviewer. I want to speak about for a bit, because sometimes students they say that we don't want to work as a QC reviewer. I'll say yes to it. The reason is when you go into some company, initially what they don't give you some writing work. Hmm? Writing work is mostly with the experienced people. So what they give you initially is document to verify the data. But what a good thing happens in that, you get introduced to all the different documents like protocol, ICF, CSR. So once you get hands on that, then writing becomes very easier for you. And there is, for device companies, sometimes they write, give it a name as a technical writer instead of just saying medical writer. If it is a device company, they say technical writers. So these are very much entry level positions. Even clinical trial transparency associate, document anonymization associate. So roles are many. Now, who hire these medical writers? You very much familiar that pharma company, that's it. But CROs, contract research organization. And I'll say that even if you can get initial job in CRO, it will give more exposure than a pharma company. They are pharma company, they have one trend. They, if you are having already experience from CRO, they prefer you, you know, because they know that you got trained on lot many things. Biotech company these days, you know, they are very actively hiring. Medical device company, medical communication companies, educational companies, and of course you can work as a freelancer. Now I can give you example of few companies, very few companies, so that on a Naukri.com or a LinkedIn, you can just explore the job posted by these employers and can try to see that what you know, type of job roles they are, you know, giving an ad and they are hiring, like Bicon, Praxel, TCS, Syneos, Indigene, you know, many more. They are just exemplary few names I have given. Just so why I have given Indigene is that they are the only company in India. They are giving fully work from home. One thing, and they are very much in a scientific writing. So many of our students, sometimes they are coming from a medical background, you know, like your BDS, BAMS, or maybe I have seen one student from a veterinary background. So here, if you wanted to work in a more in a scientific writing than a regulatory writing, I mean, this is the one of the big organization in India. Syneos Health, I guess also they are giving work from IQVIA. If not full work from home, at least they are a hybrid, like 2 days in office and all that. PPD is also very big name, you know. So you can also do your homework. See, don't leave everything on the courses, on faculty. We can give you a direction, right? So when I was starting my job, you know, so me and my friend made a point that every day we will be applying in 5 jobs. So we used to do these type of things, you know, so that you never know from where you can get a right opportunity. And if you are, you know, giving yourself these type of targets, like I will apply at least one job, you are keeping yourself prepared. Now, salary or compensation, I just took this data from Naukri.com, right? It ranges from 3.5 to 5.5. This is entry level, and some good organization, they are also offering 6 per annum. So now there are two splits. If it is a smaller company, they are just ranging too little on a lower or you know, side. But if you are speaking about a good CROs like your Syneos, IQVIA, they're the big names, or pharma companies, they are going on a more a higher end range. But my again suggestion is, no matter what first job is, take it, right? So, but they don't look at this. But the growth in a medical writing is very good. Growth in the sense that even after initial job, once you are able to take, you, if you are hardworking, you are good learner, you are learning your all the skills during initial stage, focus a lot on learning, you know. So you can switch your jobs, you can change, you know, and then can get in yourself into a better salary. Now we can take the questions, Dr. Ajit, so I can.
Yes, definitely, guys. So if you are having any questions, please write the questions. And before that, let me tell you, I'm also sharing the link of your, what we say, the attendance link, and you guys can start asking the questions. And let me answer some questions I was getting, how you are going to assist us after the course in the career. So see, I have already mentioned in the chat box. See, we are assisting you through many ways. Okay, through many ways. And what are those ways? We are conducting the test series, we are conducting the mock interviews, we are giving you the hard copy and soft copy material, whatever is provided. We are giving you the recordings, we are giving you the references and recommendations. Okay, so don't worry about the job assistant. At any extent, we will, provide you the job assistant from our side. At any extent, whatever is needed, we will provide you the job assistance. Okay, so don't worry about that, right? And whatever the other questions. Okay. Which course you are asking about, guys? First, right. Can you give an example of medical writing? What you are asking, guys? Which is better, medical coding or medical writing? See,
मैं अभी मैं कैसे बताऊं कि बटर मसाला अच्छा है या पनीर मसाला अच्छा है? It
exactly.
depends on your choices. You
It is,
are
yeah, your interest and your choice makes it,
correct.
whatever you want, guys.
No, I
Both are,
can little help also. It's okay. Dr. Ajit, they can do some homework also. See, here you and me, we can give them bit of guidance, but ultimately they are the one who are knowing themselves. Do homework. Do that. Do you have a flair to write? Do you like sit, read, and write and you know? Try to answer yourself, right? And medical coding, the way Charanjit ji has guided, do you have an interest in that? So based on that, choose that, right? So there won't be a one, you see, no, we can't answer for you. You have to find an answer for yourself. That's one word
no,
answer.
Sarabji, I have the better answer. See,
Okay.
I have the better answer. In our medical coding and medical writing, there are the 7 students who have chose both. Okay, who chose both? They are in the both courses in the medical writing, medical coding. Let me explain it, guys, for you. See, it is not about the cost. Cost is just 7,000, including both the courses. So it will not make me rich. But I'm telling you, you should have all the options with you when you are graduating. Okay, you should have multiple options for your career, options like choice one, whatever is your interest, then choice two, choice C, ABC. You should have multiple plans with you, and these all are skill development value addition courses. Okay, whatever value, whatever skills do you have with you are not going to wane. Okay, if you work in the medical writing or if you work in the medical coding, you will have the extra knowledge always, right? So it is up to you, and both the courses are having independent career options, so you can choose whatever you wish. Okay, all the courses have, I mean, these all the domains what we are talking about today, both the domains have multiple jobs and different job options. Okay, so we are not the definitely right persons. I'll tell you, you join both the courses because both are skill development value added courses for you, right? So you have to choose which one you want to choose. But I always say, my all the students, keep as many as skills with you. When you are going to the market, you will have multiple career options with you, right?
Dr. Ajit, I do these things till date because there are a number of opportunities to join the conferences. You know, all those are paid
Absolutely.
conferences. So
Yes.
I join most of them that I will learn something. Sometimes I join that just to know like what is happening in that field. So
Yes, yes,
so
yes.
if the amount is very small, I will tell you that if the decision is easy for you, that okay, in the cost of 1 or 2 genes, I can learn something new. That's an easy answer for you, right? So you can try.
Definitely. And that is again, always helpful. How many skills do you have with you is not the questions. As many as skills you have with you is the right answer. Okay.
Is the uh, there is not as such, I will say that mandatory, but adding this in your CV always give you a edge that suppose you are going for an interview and that you are telling in your introduction that I have done some certification in a medical writing. So
Yes, true.
instantly it gives an idea, the person who is interviewing, that okay, he or she is having a basic idea and this person is inclined in this field, intrigued, they will do better,
Yes,
right?
yes,
So
yes.
definitely it will give you an edge. Of course, the learnings and plus you will be able to perform better in the interview. These days competition is very high, right? So having a certification in your CV is a value addition. See,
Yes.
I am already working in my job. How I am adding value addition in my CV by attending more conferences, adding some certification, doing something additional, because what I have learned in my graduation, that is like many years back. So it is
Yes.
giving you edge, definitely. What else?
Okay, what are the questions, guys? HR emails, please. Which HR emails you are asking, Varsa? which field has more salary in the future, medical coding or medical writing? Please answer, sir, because I am working in insurance company as claim processor for past 1 year. Okay, that I am very, if I answer, it will be a very blunt. Sarabji, could you, go for answering this question?
There are a couple of things medical students, I think they have not paid attention. Medical companies, I think I have shown one slide, right? I
Exactly.
named Hana, so you can do homework as well. Placebo is a there was one question on a placebo also. It's a copycat drug. Go to Google, go to ChatGPT, find more answers. Right, I'm giving it back to you. Regarding salaries, the way Charanjit has told, like about a medical coding, the medical writing also goes on same line. On the same
Absolutely.
time, it also lot depend on you, that if you are hardworking. I have seen people, senior medical writers, Dr. Ajit, after 5 years of experience, they are earning like between 15 to 20 lakh per year. So it also depend on your skills.
Yes, definitely. Definitely.
Yeah, so
Always,
if
always.
there are people, they are sitting in at one place only, they don't want growth, they are not learning, so their salary might be bit less. But there are people who are very agile, their salary will be very good. Medical writing, I can take a guarantee. It's a career for life, I always say. And
Yes. True. True, 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 true. No doubt.
course,
Okay,
Dr. Ajit,
guys.
people are asking fees for medical writing. I am sorry,
Fees
I
for
already,
medical writing is
yeah.
3,999 just for the diploma certificate course. For the diploma, just 3,999. And I'm sharing our website. Here you can check all the courses which we have talked about today have launched. So you can check the website, you can check the brochure there, you can check the fees there. Everything is there. You can register directly from the website. The Curio CTRI, I have shared the website here. Guys, I have shared the website. Please go and visit the website and you can register directly from there. Okay, and this option is for today itself. If you are registering today, then only you are getting the seat. Otherwise, we are not sure if we can extend the dates. If we are extending the dates, if there are the seats, we can extend the dates, but not sure. Okay, so if you want, you can register today itself. Sir, what do
There
you,
was
okay.
one question, Dr. Ajit. They were saying that is there also some exam for medical writing? Just try to understand why there is exam for a medical coding, because you are working in US. So they have some exam, you have to clear that, right? In a
In
medical
medical writing,
writing,
you will have assignments from our
yes,
side for sure.
yes, but there is no such paid exam, right?
Yeah,
But there will be.
there
Hmm.
is no such certifications. There is no paid certifications for medical writing anywhere. Class timings will not merge at all because medical coding has only Sunday. You will have medical coding class only on Sunday afternoon, 2 hours class. Every Sunday, 2 hours class in the afternoon. Medical writing classes will be 2 days in a week, like either Friday or Sunday or Saturday or Sunday after 6:30 p.m. So not mingling with your schedule, your day schedule at all. Okay, you can register your classes will not class at all. You will have free time to attend these courses. Okay, so medical coding classes 2 hours every Sunday and medical writing classes 2 days every week. One is Sunday, one is Friday or Saturday. Okay.
Oh, Dr. Ajit, we try to keep classes different at different time, right? Even I have
Yeah,
seen
yeah.
past.
But in the evenings, for sure, in the evenings. In the weekend, if this is a weekday, Friday or Sunday, Saturday, you will have the class in the evenings only, either 6:30, 7:30. It doesn't matter, but you will have the classes in the evenings only and Sunday afternoon.
Someone asked me, ma'am, can you give some insights on medical writing interview in terms of technical side? And
Guys, you
that's
can
what we
visit
will
our
teach. That's what we will
Sarabji, one
teach.
thing I'll tell them, you please subscribe to our YouTube channel. You will get everything there. We have mock
Yeah.
interviews for medical writing, pharmacovigilance, medical coding taken in our previous batches. Those are freely available for all of you. Please visit our YouTube channel. You will get all type of interviews, mock interviews, everything in our YouTube channel. Okay.
Yeah, but in short, I can tell still can
Yes,
tell
yes, please, please,
here
please.
that yes, on a technical side, you will be asked a lot many questions. In a medical writing, there are 2 to 3 rounds of interview mostly.
Yes.
The initial round, second round, and written test is also there, right?
Yes.
So, and it is not difficult. I am telling you, if you have paid sufficient attention in the course, you will be able to clear it easily.
Okay, there is no specific certification exam for medical writing. Okay, Hamida, do not, you don't have to write again and again. There is no certification exams for medical writing. CPC exam cost, as she told, 65,000 rupees INR.
Amir Patel has asked that he's a second year student only. You can definitely start as a learning in a medical writing as of now. You can,
Yes.
after this course, you all.
I have shared our YouTube channel also. You can just subscribe to the
Yeah.
YouTube channel. This is the link for today's webinar. But through that, you can go to the YouTube channel as well. Okay, guys?
But for freelance, I will say freelance, you can start once you have gained some experience, as at
Yes.
least do 2 to 3 years of job, then aim for freelancing. Initially it is not that easy and you won't get paid better. The main thing is once you have experience, you will get a better pay for a freelancing work as well.
Yes, absolutely. Okay, guys, fine. Can we do these courses along with internship as PharmD interns? For PharmD interns, we have a specific price. We have different price. PharmD interns, not PharmD interns, sorry. If you are CLIMAD intern, we have straight away some discounts for our CLIMAD interns. That is 50% discount. Okay, if you are CLIMAD intern, you will get these courses in just 2,000 and 1,500 rupees. Okay, that is the advantage of being a CLIMAD intern, right? The medical writing course you will get only in 2,000 and medical coding you will get just in 1,500 if you are a CLIMAD intern. How to become a CLIMAD intern? Now CLIMAD internship will come in November, not now. We already have 2 batches. So the next batch will come in November or maybe January. I'm not sure. So we have to complete these 2 batches and then next batch will come in January. Okay. So thank you guys. Please visit the website and please fill the form for your certificates. If you wish the certificate, I'm sharing again all the links. Please, okay, this is the website. Sorry, I think somebody is having personal. Okay, so please visit our website. You will get all the courses there. Okay, you will get in the new launches, you will get that. Okay. And here is the feedback link again. It is going to personal, someone personal. Why you are sending the personal messages, guys? Yes, thank you everyone. Thank you very much. Thank you. Thank you. Thank you guys. Thank you. Okay. And please
Thanks
do it. So
everyone.
thank you everyone. Thank you, Charanjiji. Thank you, Saurabh ma'am. Thank you very much, guys. See you then and
Bye
see you in
bye.
the course. I can expect many of you in our courses, guys. So thank you. Take care, guys. Bye-bye. See you.
Bye bye.
If you are registering, then you will get the confirmation through email from our side. First, you will get the registration receipt, payment receipt, and then in a day or two, you will get the email from our side, my team. Okay. Take care, guys. Bye-bye. See you.